Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The family APGAR assesses family function by evaluating 5 domains: adaptability, partnership, growth, affection, and resolve. It measures perceived family support and satisfaction. The tool aims to identify families at risk for dysfunction that may impact mental health or chronic disease management. Its main purpose is to provide a quick screening method for clinicians to detect family dynamics that influence patient outcomes. The assessment supports early intervention to improve psychosocial functioning and adherence to treatment plans. The family APGAR is indicated for adult patients across diverse clinical settings to evaluate perceived family support and functionality. It is most useful in primary care, mental health, and geriatric contexts where family dynamics impact patient health outcomes. Research demonstrates its effectiveness in identifying patients with family dysfunction that may contribute to psychological distress, chronic disease management challenges, or care non-adherence. The tool facilitates early detection of family-related issues that influence recovery or coping mechanisms, particularly among individuals with depression, anxiety, or chronic illnesses. Its brevity and simplicity enable routine use during initial assessments and ongoing follow-up consultations to guide interventions aimed at improving family support systems. The family APGAR consists of 5 items designed to assess family function across 5 domains: adaptability, partnership, growth, affection, and resolve. Each item is a statement requiring the respondent to evaluate their perception of family support and satisfaction. The response format is a 3-point Likert scale, including the options rarely, some of the time, and almost always. Each response is scored from 0 to 2, where 0 corresponds to rarely, 1 to some of the time, and 2 to almost always. Total scores range from 0 to 10, with higher scores indicating better family functioning. Scores of 7 to 10 suggest a highly functional family environment. Scores of 4 to 6 indicate moderate dysfunction, warranting further assessment. Scores less than 4 reflect significant family dysfunction and may require intervention. This scoring system facilitates quantitative evaluation of family dynamics in clinical settings. The sensitivity of family APGAR reflects its ability to correctly identify individuals with family dysfunction, whereas specificity indicates its capacity to correctly identify those without such dysfunction. Studies have reported sensitivity values ranging from 70 to 85%, demonstrating that family APGAR effectively detects most cases of family dysfunction. Specificity values vary between 75 and 90%, indicating a solid performance in ruling out dysfunction in well-functioning families. For example, if family APGAR is used in a clinical setting to screen patients, a sensitivity of 80% means that 80 out of 100 patients with family dysfunction will be correctly identified. Conversely, a specificity of 85% implies that 85 out of 100 patients without family dysfunction will be accurately classified as having no issues. These metrics support family APGAR as a useful screening tool, balancing false positives and false negatives in assessments of family support. The family APGAR test, developed in the late 1970s by Smilkstein, was designed as a brief instrument to assess perceived family support across 5 domains: adaptability, partnership, growth, affection, and resolve. Validation studies have demonstrated its reliability and construct validity in diverse populations. For instance, Smilkstein and colleagues reported an internal consistency coefficient exceeding 0.8. indicating a high degree of reliability. Subsequent research has confirmed its predictive validity for family function and its correlation with health outcomes, such as mental health status and adherence to treatment regimens. Cross-cultural validations have been performed in various settings, supporting its utility in both clinical and research contexts. The test's brevity and focus on subjective family functioning have contributed to its widespread acceptance and its role in identifying families at risk for dysfunction that may affect patient care. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.